Hi, today we're going to show a little bit of an adjustment on the mid-back. So we get some of our patients, some of the newer patients that have anxiety over what to expect when they come to a chiropractor. They get a little scared about what they're going to see. So today we're going to show a couple different techniques for the mid-back to be able to adjust that. The two main techniques we use with the mid-back, we use more of a manual technique, the normal popping and cracking you think of, and we use an activator technique as well, which is a really light tool adjustment though that actually helps to move that bone. So the first technique, we're looking at the mid-back here, right through anywhere from the lower neck all the way down to the low back with it. Right in that area, you see a lot of people that do repetitive movements with their arms in front of them all the time. They get a lot of pain through that area. So we're looking for the specific bone that we want to adjust. We get right into that area. A lot of times it might be right in between the shoulder blades there. One hand on one side of the spine, another hand on the other side of the spine. You lift up, a little press, and press down like that. And you'll feel a little release, a little audible with it. They'll actually get that bone to start to shift, take the pressure off the nerve, get those muscles to calm down around it then too. Helps to get some of the swelling out of the area too as well. So it works really well on a lot of our patients with it. Another technique we use is called an activator technique. The activator looks just like this. So what it does, it puts a very light adjustment onto the area, just kind of thumps on it really slightly. So we get right in that mid-back, we'll find that bone again, we'll figure out which direction that bone is turned, and you're putting a little pressure right into that area, and just a thump like that. So you're working right on the bump on your spine, you might work on the edges of that bone as well, and you're getting that bone to shift and move. The activator technique works really well on a lot of our patients who are, we use it on some of the babies that we have in our office. We use it on any people up to 90, 100 years old that actually this works really well on. So if you've got fibromyalgia, if you've got osteoporosis, this is a great technique to work with it as well. So the last alternate that we can do with a manual adjustment is called an anterior adjustment. It's a little different, works well for a lot of people. What it does is we'll have the patient turn over on their back. They'll cross their arms across their chest. You roll them to the side and you get a fist right underneath their back, right at that area of the spine. You come right there, we press down on the area, and you'll feel a little release with it. You feel that audible with it where it's going to pop in there with it. What that does, why that technique works so well, is that you're using your own body weight to come down on that area and get that bone to shift and move like you want it to. And also there's a curve in your spine and your mid-back that bends backwards. So that actually helps to kind of promote that curve in that mid-back there. It takes the pressure off it, and it's able to get that to release a lot easier on some people. So that's another great technique we use in our office and works really well for the mid-back. Thanks for watching, guys.